There are dozens of Medicare scams going around today. And if you're not careful, scammers can steal your identity, which could cost you thousands, if not tens of thousands of dollars. And to make matters worse, Medicare scammers today have evolved so much that sometimes you won't even know you're being scammed until bills arrive at your house.
I can't afford that.
That's why in this video, I'll explain the types of scams to you and then go over the 5 biggest Medicare scams in 2025 and how you can avoid unknowingly giving your money away. There are generally 2 types of Medicare scams: Medicare fraud and deceptive agents. People who commit Medicare fraud are really after your personal details and your Medicare number. With these 2 things, they can start filing fraudulent claims to Medicare using your details. They do this by posing as a facility that sells medical equipment such as wheelchairs, and then they make a bunch of false claims to Medicare using your details. Not only does this hurt the whole Medicare system because taxpayer money is going straight to fraudsters' pockets, but it could directly hurt your wallet as well. When fraudsters use your details to make claims, you will get a bill in the mail that says you're responsible for paying copays and deductibles for these items. And that's why you need to be careful with your Medicare details. Giving them to the wrong people can cost you hundreds, if not thousands of dollars. The second type of Medicare scam is when you are deceived by a greedy sales agent. There are lots of variations of this scam, but the bottom line is that these agents try to enroll you in a Medicare plan that pays them the most commission, and they don't care whether or not it's a good thing for you. Some people might argue that this is technically not a scam, but I really feel that it is. The reality is that when you enroll in a plan that doesn't cover your treatments or your drugs, or a plan that your doctor doesn't take, you feel like you've been scammed, right? And if you end up spending thousands of dollars more than you would have on another plan, well, I think that's a scam. Because while you are caught in a bad situation with a plan that doesn't fit your needs, the agent gets away with getting a commission for the plan that they sold you. And that's why it's really critical to avoid these guys. But all right, with that out of the way, let's take a look at the 5 biggest scams in 2025 that you need to look out for, and also what you can do to avoid both the fraud and the deception. The first scam is when an agent promises you freebies in exchange for your information. This is a very common scam used by fraudsters to get your Medicare number. They call you up, they say that they're from Medicare, and then they promise you freebies like a free knee brace, a free consultation, a free plan upgrade, or really anything. And all you have to do is confirm your details with them. Usually, once you give them your details, they will find some reason to get off the phone and you'll never hear from them again. And little do you know that they're going to use your details behind your back for a bunch of fraudulent claims to Medicare. Again, this doesn't only use up taxpayer money, but it also makes you responsible for copays for items that you didn't even order or didn't plan on using. And a lot of people pay those bills when they come in the mail. That's why if someone ever says that they're from Medicare and they're promising you free things, put the phone down. Medicare will never call you to give you freebies. I know it's sad, but it's the truth. There's no such thing as free when it comes to Medicare. So if someone calls you and says that they're from Medicare and they're promising you something, that's not Medicare. If someone shows up at your door claiming to be from Medicare and wants to give you something for free, or wants to verify your information at the door, that's not Medicare. And if you get an email from Medicare saying that you're entitled to some kind of plan upgrade, that is not Medicare. The second scam is when people promise you freebies if you switch plans. And you're noticing a pattern with the freebies thing here, right? This is one of the scams used by greedy sales agents who try to convince you to cancel your current plan and sign up for a plan that pays them. Usually these guys are selling Medicare Advantage plans with plenty of shiny perks. These agents will tell you that if you join their plan, you'll get flex cards to pay for your groceries or maybe an allowance for your utility bills, and all that sounds great, right? Well, these are real perks of some Medicare Advantage plans, and many Medicare Advantage plans actually have freebies like this. Now, you need to be very careful when someone pushes you to switch plans because of these perks. Even if you're going to switch plans, it should be for better healthcare coverage, not because of these freebies, right? Also, a lot of agents will use these freebies to bait and switch. Sometimes they'll say that the plan has these extra benefits, but then you'll find out that you're not eligible because you don't live in the right area. Or even if the freebies and the benefits are real, you might find out that the plan is not the right fit for you. Maybe it doesn't cover your treatments or your medications. Maybe your doctor doesn't even take that plan. All of this can lead to you spending a lot more than you should because you took the bait on the freebies when you really need to look at your total health care. And that's why you should be very careful when it comes to people advertising these type of extra benefits, whether it's on television or if it's someone calling you on the phone. You'll notice that there are a lot of these advertisements around October, November, and December because that's when most people are allowed to switch their plans. And that's why these scammers come out in full force during these times and try to get you to switch. And as a rule of thumb, try to avoid plans that are coming to you. Instead, you want to be the one doing research. You want to be the one that's getting in touch with a licensed insurance agent. You want to find a plan that fits you and contacting the plan or the agent instead of having them contact you. The third scam involves someone supposedly from Medicare contacting you to say that you need to replace your Medicare card. This was a very popular scam a few years ago, and Medicare actually issued new Medicare numbers, but it's still very much around today. And what happens is someone calls you or visits you saying that they are from Medicare and then tells you that they need to replace your Medicare card with a new one. They might even say that you can get a new laminated card instead of the piece of paper that you have. And in order to make this change, you'll need to provide them with your Medicare and personal details. You can probably guess what they're going to do with your details once they have them. The next thing you know, they commit fraud. And you receive bills in the mail for co-pays on items that you didn't order or perhaps on services that you did not receive. This has been a super effective scam for scammers because getting a replacement card doesn't sound as suspicious as receiving something for free. And many people don't realize how harmful giving away their Medicare number can be. Also, keep in mind that Medicare already has all of your details. Even if they need to send you a new card, which they don't right now, you don't have to give them your details in order to receive it. I guess the moral of the story here is that you should never give your Medicare information away for no reason. You'll want to protect your Medicare card the same way that you protect your Social Security card or your credit card. You don't just give your credit card information to some random person on the phone, right? Well, you shouldn't. And the same goes for your Medicare information. Really, the only person you want to share your Medicare information with is your trusted licensed insurance agent and your trusted provider or doctor. Other than that, keep it away from people's eyes and ears. Now, before I get to the last two scams, let me just jump in here and say that if you're finding this video helpful, please hit the thumbs up button. This not only supports our channel, but it also helps this video to reach other people who might be victim of these scams in 2025. Also, please consider subscribing because we have a lot of helpful videos coming up soon. All right, let me get back to the scams. The fourth scam is sales agents lying about your Medicare plan options. And you could argue that this isn't exactly a scam. But again, if you enroll in a plan that doesn't fit your health needs, you can end up spending thousands of dollars more than you have to, all while the agent who processed that enrollment or who helped you change is pocketing a lot of commission. So to me, that sounds like a scam. Now, there are many ways that this happens, but what I have found is that this is a super common scam right here on YouTube. If you watch several Medicare videos on YouTube, you might have the impression that Medicare Advantage plans are bad or that they are even evil. Many agents here on YouTube are only licensed to sell Medicare supplement plans, and that's why they go out of their way to throw dirt at Medicare Advantage. They want people to believe that with Medicare Advantage, your out-of-pocket costs are going to be insanely high, or they make you believe that Medicare Advantage plans will make it so that you can never get the treatment that you want because of prior authorizations. In reality, though, a study by Kaiser Family Foundation found that 92% of prior authorization requests are accepted with no problems at all. And the other ones that are declined, the numbers show that 83% of the time, the decision is overturned in the case of an appeal. Add these numbers up and you realize that 99% of the time, if you need a treatment, the Medicare Advantage plan will approve it no problem. Now, I'm not saying that Medicare Advantage plans are perfect. They definitely do have some downsides that you need to be aware of before enrolling in one of them. However, whenever somebody is openly biased against Medicare Advantage, this should sound alarm bells in your head. It is a very big red flag that they may be trying to enroll you in a plan that profits them at your expense. To avoid agents like this, make sure that you talk to someone who can help you enroll in both a Medicare Advantage plan or a Medicare supplement plan. When you're looking for the right plan for you, you want an agent who represents all of your options, not someone who openly bashes one type of Medicare plan. Now, let me just throw in a quick plug here and say that if you're looking for an unbiased licensed insurance agent, you can contact us here at PlanFit. Our team is paid by salary, not commission. So they literally don't have any incentive to prioritize one type of plan for you over another. Instead, we'll look at your needs and help you find the plan that fits you best. That's why it's called Plan Fit. Now, whether that's a Medicare supplement plan or a Medicare Advantage plan, it doesn't really matter. We're just going to find what fits you best. And best of all, our services come at no cost to you. So you can call or text our team of licensed insurance agents at 877-360-6565, and we're happy to help you. Now, the fifth and probably the most jarring scam out there is when people use threats to get what they want. Yes, threats. They'll say things like, your Medicare account will be canceled if you don't act quickly. Or they might say that you're going to be charged extra if you don't do something about it immediately. And how do these people say that you can get out of this urgent manufactured crisis situation? Well, of course, it's by giving them your Medicare details. Now, this is not so different from the promise of freebies or the replace your Medicare card scam. However, the reason that this is so effective is because of the pressure tactics. Note that there is always a time or a deadline or some limit involved. They use fear to get you to act fast and to act as fast as possible, all before you can process that you're being scammed. Now, to avoid this, always keep this fact in mind. Medicare will never call you like that. The only time Medicare is going to call you is if you call them first and request that they call you back. Medicare isn't reaching out to people all day by phone. And if someone ever calls you and says that your account is in danger, or for some reason that you need to verify your information by phone, or you need to verify it with this agent on the call, you can also call Medicare's official number and inquire for yourself. You can check if your Medicare account is under threat or if there's actually a case that needs to be resolved. So don't respond to the person who's calling you. Say, okay, thanks for letting me know, hang up the phone, and then call 1-800-MEDICARE. Then you know you're getting to Medicare directly, and ask them if there is something that needs to be resolved. Then block that phone number, and if you have information about them, report it to Medicare, because that person is definitely up to no good. So those are the 5 biggest Medicare scams that we are seeing currently in 2025. So remember to always stay vigilant, because there are many more of these scams out there. But now that you know how they work, you can no longer be tricked by these greedy scammers. Remember, never give your Medicare information to someone that you don't trust 100%. And then for those greedy agents out there, just put the phone down and only talk to licensed insurance agents that you can trust. Other than that, thank you for watching today, and I'll see you on the next one. Bye-bye.